Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Good morning, everyone, and welcome to another episode of our health hour sessions. It's great to see you all. And as was mentioned earlier on, we will be live streaming this onto YouTube, Facebook, Instagram, and I think perhaps LinkedIn as well. But great to see you all. Many of you will know Saturday after Saturday, we continue to educate ourselves so we are better informed to shape our own, health and well-being. So welcome. CAHN, the Caribbean African Targeted Health Improvement Program, is brought to you by the Caribbean and African Health Network, Croydon BME Forum, Enfield Caribbean Association, Black Health Initiatives, and then the RCCG Royal House in Sheffield. This morning and early afternoon, we're going to be looking at asthma and how to prevent medical emergencies. And we're so delighted to have someone who is well known to the community. He's no stranger on, these sessions. He's been with us right from the very start in 2020. He's been amazing, and he will be taking us through this session. Great, we're able to record it and people can go back to it, as well. So the pleasure is mine at this point to hand over to, one of our leading consultants and expert, well-renowned around the world, Dr. Mohammed Kamara, to take us through the session. Over to you, Doc.
Oh boy, thank you for that. Right. Good morning, everyone, and thank you for having me. Where are we? Let's start sharing. Right. So we're talking about asthma today, and asthma is a big topic, and so it's difficult for anyone to say you will probably be able to do all you want to do about it. However, I shall try my hardest to give you the salient points on what you will need to do or what you need to know in order to manage asthma if you've got it, and what would help to probably prevent a death, because believe it or not, the reason why we talk about this is because asthma kills. And it's so important that the World Health Organization actually dedicated a day to asthma, which you may well see as it is on the 5th of May, which is apt as it were. We're presenting today, and May is just around the corner. So 5th of May is World Asthma Day. So what is asthma? I always ask this question. Now, if you look at the picture on your right, it's easy to follow. This is the picture. It's like it just dramatizes or maybe graphic representation of what the lung looks like inside. The first thing you see there is you'll see it in the video, probably better illustrated in the video. But if you look at the front of your neck, you see the rings, and in men they call it the Adam's apple. That's what we call the trachea, and in layman's terms, it's called the windpipe. Is where the air goes in, and then it divides in the middle of the chest into the right and the left, into bronchs. That's what they call it. And then the bronchs divide. There's 3 on the right, 2 on the left, and then they further divide into smaller bronchs, which are called bronchioles, and they further divide into smaller, and then get to the very end where there is what we call alveoli. This is where the exchange of gases happens. So when you breathe in oxygen, it goes in and then cleanses the lung and the blood and all that. And then when it comes out, it's carbon dioxide. So what does that is this bit you can see here. That's it. So this bronch is full of muscles. And of course, it's got these rings. So when it's normal and it's relaxed, that's what it looks like. And when it's actually affected by asthma, that's what you see. It's constricted. It's really narrowed. And when you use the medication, the second or the middle bit is similar to that, but then you can see that the medication is doing that for you. So that's just a preamble as to what happens with asthma. I hope you understand that. So asthma itself is an inflammatory illness or disease of the airways, which I've just talked about. It makes breathing difficult. And of course, that reflects on the physical activities to the point where what you used to do without struggling becomes a problem. But as I say, a bit about asthma, 25 million American people do suffer with asthma. And amongst those, you have 1 in every 12 child. So 1 in 12 children do have asthma. And so asthma is very, very common. And as I said, it kills. It kills up to 500,000 people a year, believe it or not. So when you breathe, obviously, you don't have any element of asthma. You don't have any problems. You don't know anything about it until the airway becomes a bit of a problem. Then you know exactly what it is. And amongst all the things that kill, the airway is the first thing that kills. So therefore, it's very important we talk about this. So key statistical, facts about asthma. As I said already, almost 500,000 people, 500,000 people died, every year. And of the population of the world is probably getting up to 300 million. So it just, it gives you an understanding that a quarter of a billion people are affected. And of course, amongst those, 500,000 die every year. It's very important you understand that. This is sad because it is important to note that most of the asthma-related deaths, i.e. the 500,000 I talked about, they do occur, sadly, in our parts of the world, in low and middle income countries, where asthma is underdiagnosed and, of course, is undertreated. So that's something that we need to think about. How do we get that up to that level that we expect it to be functioning, where we can prevent death? The World Health Organization is obviously committed to improving the diagnoses, as trying to diagnose it and treating it, and of course monitoring asthma in order to reduce the global, the burden we have. I'll tell you shortly about the impact that asthma has on the world health status, as it were. As you know, or maybe you don't, we have what we call non-communicable diseases. Now, one of them is asthma. The other ones, a few of them we know already. There's diabetes, there's hypertension. So it's important we talk about this as well because it kills people. So as we said already, it's underdiagnosed in our parts of the world, and people who are undertreated while suffering with asthma will suffer from, sleep deprivation, because it's normally at night, very early hours in the morning. That's when it triggers. That's when it flares up, and that's when you get the symptoms. So it's important to remember that. If you've got a child who's coughing, and nothing helping it, especially about 2, 3, maybe 4, or wakes up when they normally don't wake up till about 10, then remember you need to look at something. That impacts on the attendance of school. So obviously they miss out on the schoolwork, they miss out on the development, they miss out on the education. And of course, with that, you have a financial impact on the family and the community at large. So it's very, very impactful, asthma itself, not only on the individual, but in general, the community, and of course, the country you're living in, and in actual fact, the world itself. So if asthma symptoms persist, i.e. they get really bad, then clearly you need to be making your way to the A&E, emergency department, which is where I am, and would have to be treating you. And once we treat you, we would have to decide whether the treatment is, okay, and you back to your normal self, or it's that bad that we need to keep an eye on you. And sometimes we even need to keep you on a ventilator to help the lungs develop a bit of resistance, get better, and then be able to sustain you as you move on. As I said, it can kill. And as we know already, it kills up to 500,000. But have a look at this. I've said a bit. There's a lot more to cover, but maybe this would give you an understanding as to what asthma is.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack.
So here you go. I hope you enjoyed that. And I think that is absolutely superb in terms of explaining what asthma is like and how we present and what can be done. As it is, obviously, nobody knows exactly what is a single cause of asthma. That has not been identified yet, but the researchers believed and they still believe it's caused by a variety of factors, including genetics. So i.e. if you have a family member or a sibling who's diagnosed asthmatic, then you're likely to develop it. And when I say likely, that does not mean you are going to. Likelihood is there, the percentage is there, the possibility is there, but that does not mean that's what's going to happen. Of course, if you have viral infections and you're prone to viral infections, like the one that affects the upper airway, which is called respiratory syncytial virus, then obviously you're more likely to develop that condition. They talk about hygiene as well as a theory which explains when babies aren't exposed to enough bacteria in the early months and early years, the immune system does not become that strong enough to fight off asthma and other allergic conditions. Many factors trigger asthma and cause symptoms to worsen. as you can see, the triggers you have. Some people, believe it or not, you go from the warmth of the house, and as you go outside, that first gust of wind, cold wind, can actually trigger it. You know, sometimes exercise. I know of a very prominent and very, very world-renowned footballer who was asthmatic, but he lived a fulfilling life because before he goes into the pitch, he actually uses his medication, and that lasts him for about 45 minutes. And then he tops up after the break, after the interval, and then comes back. So he's made his name and he's made a career, and he's still alive with us, carrying on and doing things, you know. So respiratory infections, allergens, as you are, the pollen count, you know, the pollutants, obviously, these are all, you know, factors that would sort of trigger that. And that continues into this, as you can see. Those of us who like pets in the house, the cats, the dogs, the rabbits, and other ones, you know, domesticated pets, they have this dander that they actually sort of get rid of, you know, and so sometimes that can be a trigger. You know, certain medications, aspirin, ibuprofen, you know, even the blood pressure tablet sometimes can cause that. And of course, you know, penicillin and the rest of it. All of these can sometimes, if people have allergies, they can trigger that. Now, the difficulty here is when you have an allergy to a medication, and of course, you then have asthma, they're very difficult to distinguish one from the other. This is where you need the help of somebody who knows what they're doing, because once they get a history from you, they'll be able to tell what's what. A lot of people don't know that if you are taking this ramipril, which they give, perindopril, which they give for, or lisinopril, you may have heard of those of us who take blood pressure tablets, those can cause what we call angioedema, which is different from asthma. You know, you will have the same difficulties breathing, but then your facial swelling is what distinguishes one from the other. But I think we'll deal with that as we go on. Dust, as we see, perfumes, believe it or not, they know me for my fragrances, but sometimes when I get close to patients, they say, oh, what's it? He's here again, and it's triggering my breathing. You know, yeah. So people have that problem with certain fragrances. Of course, we know smoking causes a lot of problems. The pollution that you see around where there's an industrial area, you find out asthma is very prolific in industrialized areas or localities. You know, of course, we talk about some foods. Again, that's like anaphylaxis, which is slightly different, but it presents similarly, and so therefore it's important to remember that. Intense emotions, exercise, we talked about already. You know, these are the signs. So if you want to know what asthma is, the signs. That coughing we mentioned already, just continuous cough, cough, cough. You know, sometimes even clearing the throat repeatedly and all that, that may well be, you know, a sign that something is happening. Well, fatigue, obviously, because you're exhausted, you're hyperventilating, you try to get the air into the lungs, and that exhausts you. And of course, if you don't sleep at night, sorry, you are fatigued in the morning. Sorry. And that happens. And that, of course, when you cough, a lot of people don't know this. When you cough, the head and the neck muscles continue to shake as you're coughing. So every time you cough or sneeze, that head bobs and the neck bobs. And so these muscles get tired. And the head being shaken all the time due to the coughing can give rise to a headache. And of course, the tiredness can give rise to a headache as well. If you don't sleep, again, headache. So chest pain because you're coughing. A lot of people will have that. And then there's the confusion in someone who's having angina, but then has got a cough. It's very difficult, but this is what we do. Someone who's got a cold can present with shortness of breath and akin to the signs of asthma. Of course, we talked about the wheezing, and the video alluded to that whistling sound. It's typical of asthma. Yes, somebody who's got allergy, like allergic rhinitis, where the nose is running all year round. These are people who would say are atopic. You know, they've got the eczema, and they've got the runny nose, and they've got the shortness of breath, and sometimes they've got the rash to it. And of course, the heart rate goes fast, depending on the kind of medication you're using. Nebulizers have they have a tendency to increase the blood, the pulse, and of course the shortness of breath. So all of that, you can see, it's not just one, it's a myriad of symptoms and signs that you get with asthma. So what symptoms would lead you to think that, oh, hang on, this is an emergency? And I need you to take note of these. If you're really struggling to breathe, if you're gasping for air, And if you see that someone who's normally okay and now is getting confused, then it means the carbon dioxide is getting a lot higher in their blood, and so therefore it's causing them problems. If the lips become blue, pale, and the fingernails are pale, what we call cyanosis, definitely that's a very, very dangerous sign. They get dizzy, they're difficult to rouse, they can't talk in full sentences, they're gasping, And of course, if you get that, call 111 or 999, that is absolutely vital. So if you have someone who's having an asthma attack, what do? Step one, sit them up straight, or they can sit them straight because they can't even lie down. Impossible, because they're struggling to breathe. So they have to sit up and they are clutching onto the sides of the chair. And so they're gasping. So it's important that to remember that on the upright, they'll be able to take a bit of a breath, If you have the reliever, that is the inhalers, those who are diagnosed asthmatic, they have the reliever and the preventer. So take 1 or 2 puffs of the reliever every 30 to 60 seconds, to a maximum of 10 puffs. Do the symptoms improve? Yes or no? If they don't improve, then you go into, if you feel worse at any point and you don't feel better after the 10 puffs, then call 999. It's as simple as that. If it gets better with the puffs, then continue to sit, so that you keep observing them, because they can deteriorate at any time. And if they do deteriorate, then you can repeat the puffers whilst you're waiting for the ambulance to come, And then, of course, if you feel better, then you make an appointment to see your asthma nurse or your GP, But it's vital that you keep an eye on this, because the signs of an asthma attack are such that they can come all of a sudden and they can get worse. And even with the inhalers, they can get worse. So therefore, you need to be with them, keep an eye on them, and see how they're, sort of improving. Right. Then, of course, you need to know the types of asthma. Different types, absolutely. As you can see, there are a lot. So the asthma can start in childhood, which is, childhood asthma. It can start in adulthood, which is adult onset asthma. Then, of course, you have one that is induced by exercise, one that is induced by an allergy, like the allergic rhinitis you hear about. Then, of course, there's one, believe it or not, that is non-allergic asthma. And of course, the types of works that you do, depending on where you work, there's a lot of dust, a lot of, release and pollutants and all that. Occupational asthma is there as well. And of course, the eosinophilic one, then you have like certain parasites that affect the human being, and they can cause that what we call eosinophilic asthma. And of course, there is a particular asthma which is dangerous because it affects people at night only, believe it or not, and that's where you need to be careful. It's called nocturnal asthma. Then, of course, the drug-induced one, as we talked about already, aspirin, ibuprofen, they all can cause asthma, and these are the ones that are induced by this. And then, of course, there's a cough variant asthma. So as you can see, there's a myriad, there's a lot of them, but then you need to know which one, and the only way you can do that is by actually having a conversation with the specialist asthma nurses, the GPs, the doctors, and they can narrow it down to what you have, and then they will actually set a plan for you, bespoke to yourselves, to your need, and then take it from there, As I said already, the doctor will determine the type of asthma you have. And most commonly, there has to be an allergic component to it. So 60% of that, you'll get like an allergy component to it, which will trigger the effect of the asthma on you. They will prescribe you the bronchodilators, the ones that open the airway, as I showed you in the picture at the very beginning. When the bronchodilators goes in, it keeps the airway open, which will help with the breathing, because it's the constriction that causes the symptoms of the wheeze, the chest tightness, the cough, and the difficulties breathing. So here you go. I'm not going to go into details, but you can see we talked about the allergic asthma as well. You can see environmental mites, the fleas, the types of food sometimes, the dander, where there's very much of greenery in terms of the pollen, molds, can cause problems as well. Grass, and we all like the garden, but sometimes it might be the enemy, because if you have that allergic reaction to the grass, then it causes problems. You see, the dust, as it were. So that's allergic asthma. Non-allergic asthma It's the irritants in the air not related to allergies that trigger the type of asthma that we're talking about. They include burning of wood. Sometimes people burn wood in the back garden. That sometimes can cause problems for neighbors and other people who are predisposed, who are probably vulnerable. Cold air, cigarette, that we talked about already, air pollution, the viral illnesses we talked about, RSV, air fresheners, believe it or not, sometimes can trigger asthma. And of course, the cleaning products. This is one thing that a lot of people don't know. So those, we talk about occupational hazards, those who work in the cleaning industry sometimes do face that kind of thing, And of course, perfumes, we alluded to already. That's it. We talk about occupational asthma. As you can see, the dust, the dye industry, that's another one. Fumes and gases, industrial chemicals, and of course, animal protein and rubber. In medicine, we have that. A lot of people have this irritant, the rubber latex sometimes can trigger an attack. Those in farming and the textile industry, woodwork, because you are, sawing the wood, and it's that actually, triggers the asthma. Yeah, I talked about this already. As I said, exercise-induced asthma, affects, people within a few minutes of starting the exercise, up to like 10 to 15 minutes, and then it triggers it. So therefore, as I said already, this chap, he would actually use his preventers and all that before he goes into the field, and that would last him for maybe the whole half of the match, and then he recharges himself, or tops up, and then comes back, and that helps, and he's been living a fulfilling life. We talked about this already. So aspirin is another one, ibuprofen, because they're non-steroidal anti-inflammatories, NSAIDs we call them. They're definitely known to cause that. I've had someone come to me, he was a joiner, so he kneels a lot because he has to cut the woods and things and all that. And what he did was, sadly, he didn't use the shin pads, and so he caused himself some graze on the knee, just where the kneecap is, and that became infected, became red, painful. He didn't want to come to hospital. But obviously, he's been using some painkillers, including ibuprofen. I wasn't to know about this. And of course, they struggled. When I saw him, I asked him, I got a detailed conversation with him, and I asked him, are you in any pain? He said, yes. Oh, the pain has been troubling. I said, have you been using anything? He said, oh, yeah, well, nothing much, paracetamol. I said, anything else? He said, oh, I've been using ibuprofen. I said, have you ever used it? He said, well, I've been using it all the time. I said, well, now you're not going to be using it because he was really wheezing at the time. So I realized, obviously, at this point in time, ibuprofen decided to call it quits, and therefore is not a friend of ibuprofen anymore. So we gave him some steroids. We gave him something, an antihistamine, to help him with that. And he responded well. And since then, he's not come back. So I presume he would know now that he shouldn't be using any of the anti-inflammatories like the ibuprofen and aspirin. So about 9% of people with asthma do have that. And they normally develop that between the ages of 20 and 50. Nocturnal, this is one, as I say, is dangerous. It worsens at night. The triggers are thought, to bring on the symptoms at night. The triggers that really do that are like the heartburn, so like somebody who's eating late, or maybe has got a hiatus hernia, and you get that heartburn thing, that could trigger an asthma attack. The dander from the pets, that can do that. The mites, from the beddings and things like that. This is definitely something that could. And also there's a cyclical sort of tendency to it, really. Yeah, another one, it's very rare, it's called cough variant asthma. It doesn't, have the classical symptoms of asthma, which include wheezing and choking. It's characterized by a dry cough, but it's persistent. And this is very rare, so sometimes it's difficult to distinguish it between the other ones, If it's not treated, it can lead to a full-blown asthma attack. And of course, that would then bring in the other features that you have of the typical asthma. But characteristically or typically, it's a persistent dry cough. I think I said that. So if someone is coughing all the time, then perhaps they need to be checked to see whether they are, in one way or the other, someone that has this cough variant asthma. So this is just kind of something of a light nature to show you what asthma does, the risk factors, the treatment, and of course the symptoms. As you can see, difficulty breathing, dry cough, chest pain or tightness, and of course the nocturnal one, the night cough, shortness of breath, not able to speak in complete sentences, and of course the wheezing. Remember the foods remember the infection, remember the pollution, and of course the genetics in it, and of course the treatment, as you can see. So that, again, this is just symptoms, the causes, and treatments. The sprays, the exercise, the dander, all of that is part of it. And again, we talked about the acid reflux, which is also one that can trigger it. So how do you diagnose it? Well, there's no single test or exam that would determine if you, an adult, or your child has got asthma. Instead, obviously, the doctor would use a variety or a set of criteria to determine if the symptoms are because of asthma. So they'll take a good history, like I told you already about the chap that I came across. If the family members do have breathing disorders, then of course your risk is higher. That would probably alert the doctor to that. So we always ask, anybody in the family with asthma and things like that, or chest problems? And then of course they say yes, or my mom or my dad or someone, or my sister, my auntie, or uncle. So and then of course you examine them, listening to the chest with this thing you can see there, that friend of ours, a stethoscope. And then of course they can probably do a skin test, to see if there's any signs of allergy to certain, either medication or certain substances, where you get hives, and of course you get eczema, and of course that person is atopic, as it's alluded to in the video, and of course if you're that person, then you very, very high risk of developing asthma. There is what we call a pulmonary function test, spirometry and all that, which would measure the airflow into and out of the lungs, the breathing test, and this would help determine whether indeed you're prone to that or not, really. The one thing that we need to note is that on the 5-year-olds, normally because of the technique, which is poor, and because of the inaccuracy in the readings, we actually don't get to test them. We test the ones who are older because they comply better and they can do things better, and then the test is more objective then. So treatment, I think we alluded to that already. Now, the only thing I need to say about this is that there is a National Asthma Education and Prevention Program. This is why it's important to do these talks, because there is prevention. You can't cure it, but at least you can prevent it, and you can live with it, and you can live a meaningful life and a fulfilling life at that, So ways of doing that, as I say, the classification